FOURIER is the largest trial with PCSK9 inhibitor evolocumab. There are several PCSK inhibitors, but this is the largest trial. In this trial, 27,000 plus patients were enrolled, and we evaluated the safety and efficacy of evolocumab versus placebo. Evolocumab was used either 140 milligrams sub-Q every 2 weeks or 420 milligram once a month. And we have shown already previously that the treatment of evolocumab in high-risk vascular disease patients, most of whom had prior MI or prior stroke or peripheral arterial disease, had significant reductions in their LDL with the PCSK9 inhibition, an average of about 60% reduction. And in addition to that, we showed that there was about 15% reduction in primary endpoint and about 20% reduction in secondary endpoint, which was the hard events, myocardial infarction, stroke, and cardiac death. So this study that I'm talking about today is the study of patients with metabolic syndrome. Patients with metabolic syndrome were described utilizing the NSEP3 ATP3 criteria, which are well established. And what we found was, number one, that 60% of our patients out of 27,000, that makes it the largest metabolic syndrome study trial ever, had metabolic syndrome. And what we showed was that metabolic syndrome, presence of metabolic syndrome itself is identifying patients who are at high risk of subsequent cardiac events within this cohort of high-risk vascular disease patients. And furthermore, we showed that these patients, when treated with evolocumab versus placebo, had significant reductions not only in their LDL, again by about 59% or mean reduction, but also a significant reduction in their primary and key secondary endpoints. But this reduction was greater than the study cohort as a whole. So that is a very important point, because this identifies the patients who are at higher risk than all patients with vascular disease, which is a major clinical clue, because we can't use PCSK9 inhibitors in every patient, even though they may need it because of the cost. And this study helps us identify those who are likely to benefit the most. So metabolic syndrome is highly prevalent, as we showed in this study, and as is known, it occurs in about 40% of the adults and people who have had vascular disease. I have previously shown from the TNT trial, 50+% of the patients will have it. And in this study, with established vascular disease, 60% of them had metabolic syndrome. That tells us that simply by looking at characteristics that are readily available, that is at the overall appearance of the patient, measuring waist circumference, looking at whether they have hypertension or not, and then 3 lipids, which we commonly do, that is triglycerides and HDL and glucose. We can identify these patients. If they meet 3 of these 5 criteria, they are metabolic syndrome patients. So what this study tells us is that identifying those patients who have metabolic syndrome clearly will identify patients who are most likely to benefit. Not to say that other patients will not benefit, but this identifies patients who will attain the greatest benefit. And as such, when we look at the cost consideration, it is well justified, because we showed today in our presentation that the number needed to treat is about 40 to 43 for preventing one vascular event in metabolic syndrome patients over a 3-year period. That's a very respectable number. I mean, any number below 50 is considered quite respectable. So I think this study provides very important data. The other point is, unlike a statin, which induces new onset diabetes, and this will be a particular concern in patients with metabolic syndrome because they are at high risk of developing diabetes. So the question that we examined was, did use of PCSK9 inhibition induce higher risk or induce diabetes? And fortunately, we were able to show in this very large group of 16,000 plus patients with metabolic syndrome, comparing it to almost 10,000 some odd 100 patients without metabolic syndrome, there was no difference between those who had metabolic syndrome versus who did not in terms of the changes in serial hemoglobin A1C and serial fasting glucose. Again, this is the largest study that had provided serial follow-up of glycemic parameters such as hemoglobin A1C as well as the fasting blood glucose over time. In addition to that, we also noted any record from the principal investigators in terms of patients having clinical diabetes. There was no difference in new onset diabetes either using these chemical criteria or clinical criteria. So the take-home message from my presentation is that patients with vascular disease are all at high risk. As I mentioned, these patients are already on high dose statin, which is the primary therapy in all patients. But if they continue to have vascular event risk, which patients with metabolic syndrome or diabetes have, and we have already published the data on diabetes in the previous presentation. This data extends that and shows us that even patients with metabolic syndrome with pre-existing vascular disease are at higher risk, and these are patients who are likely to benefit the most with PCSK9 inhibition, and in my opinion, the cost is very justified for them. So one should really pay attention to treating these patients with PCSK9 inhibition on top of high-intensity statin therapy.